So the topic is a little less discussed when we talk about breast cancer, but it is very, very important, and specifically because today the breast cancer is becoming a epidemic like thing, and soon we are having a one patient, one woman out of four is having a breast cancer. And the second thing which is very important, the age is decreasing. In our hospital, blessing of God, I start my presentation. Why these women suffer in silence when they have a cancer? And so the most attending thing about us in our capacity as a woman is to create. So diagnosis of the breast cancer can be devastating and can trigger several adverse reactions for the majority of the women. And many women can develop the symptom of psychological distress such as anxiety, depression, fatigue, pain and difficulty. In women, the loss of symbol of femininity can result in the low esteem. So we never acknowledge it as a problem, along with the emotional, mental and financial stress that cancer can cause. Many women with breast cancer also find themselves coping and changes in their appearance as a result of their treatment. Genitourinary syndrome of menopause is more prevalent in the survivor of breast cancer than in other menopausal women, and it is commonly undiagnosed and untreated. Nobody talks about it. So why? It is taboo to talk about this problem, embarrassment, and it makes a vicious cycle altogether. And the survival of the breast cancer has improved today, as we have seen in the many talks that they have a full life, and with the younger age that really the quality of life become an important thing to discuss. So what are the factors which can influence the personal variable like social demography, personality and the coping style may be associated with the stage of illness or availability of the social support from the family, friends or community, and the concurrent stresses related to illness that add to the psychological burden. So what is the sexual health? Why we are talking about it? Because it is a fundamental to overall health and the well-being of the individuals, couples and the families, and social and economic development. Being sexually healthy means being able to enjoy a healthier body, a satisfying sexual life, positive relationships, valuing and the feeling about yourself, and experiencing pleasure, intimacy, joy and the peace of mind. So what are the reasons when we see there's a being self-conscious about the external appearance of body? It plays a big role when you go for the mastectomy. Vaginal atrophy and the dryness because of all therapies, leading to a painful intercourse, depression, low libido, hormonal imbalance and the inability to have orgasm. Why should we address? We address all the health issues. Why not? It is as important as any health issue, because it can interfere with a woman's ability to live a normal life and put a strain on her relationship. So sexuality after breast cancer can be a growth experience for a couple, especially when both partners take part in the decision making and go to the treatments. I have seen few patients that their life has become shattered, even it led to a estrangement in the husband also. So this is something which is very, very important for that woman, that we see their post cancer treatment and the rehabilitation with thinking in the mind about their sexuality and the rehabilitation also. Even in the review of the research on the breast cancer has shown that a range of physical changes to women's sexuality following breast cancer, including disturbance of the sexual functioning as well as the disruption to the sexual arousal, lubricants, orgasm, all those result because of the tamoxifen in the breast cancer patient. So we have to see how these factors related to the sexual functioning. Maybe there is a psychological or interpersonal relationship factors, or there is quality which is impaired, or there is a social norms which are really interfering. And what is important is drugs. Many a time these patients has to put on the antidepressant, but we have to see all antipsychotic drugs we cannot give to the breast cancer patient. So what is the aspect of the quality of life? Body image, hair loss, sexual functioning, menopause, infertility and in other way leading to the emotional and the cognitive issues like distress, depression, anxiety. And one thing is very important that we have seen in our talk, that lymphatic drainage is very, very important. These women, many a time they develop the lymphedema of the arm, and that is really a very painful thing when a patient is developing lymphedema. So these things we have to take in consideration. So the support of the family as a couple for these things is very important. Then these body changes really put a stress on that woman. So many women struggle in silence, not even knowing that they have a treatment for it. So finding help and the support of the breast cancer treatment is very, very necessary. Support by a spouse increased patients' adherence to therapy. Studies also report that the patient with the breast cancer have expectation of the emotional support from the spouse, and they adapt themselves to the treatment process most easily to that support. Uncertainty and fear often lead to an increase in the patient's need for the social support. Efforts to understand the patient relatives' disease and the patient would probably change the perception. The quality of the life of the patient and their relatives can be elevated by determining the social support. Psychiatric treatment holds an important place in the prognosis and the adherence to the treatment of the breast cancer, and it was found that who has a treatment, they have better off than the patient who doesn't have a treatment. Vasomotor symptoms such as hot flushes may develop as a result of the anti-estrogen treatment or possibly depression or the anxiety. It was shown that many SSRI or SNRI group of the psychiatric drug reduces these symptoms, and these are reported to be drugs that contain active substance like venlafaxine, escitalopram, which is known popularly as a Nexito today, are more effective than the placebo. But some studies have shown that SSRI, which inhibit the CYP2D enzyme, and anti-estrogen drugs like tamoxifen, they should not be given because of the fear of the recurrence. So apart from the SSRI, antipsychotics which are widely used were also found to generate some adverse effect. Some drugs who has a prolactin receptor overexpression, they should not also be given to these patients. Exposure to tricyclic antidepressant at higher dose for more than 10 years would partially escalate the risk of the getting breast cancer. Sex life after cancer treatment is a little different that it used to be. So these counseling sessions are very, very important. One may not be in the mood as often, and physical side effects can leave feeling self-conscious. For instance, hair loss, weight changes, or control on the bladder or bowel, or some effect on the cancer treatment go away quickly, but some lingers. So what we have to do? Explore other ways to be close to your partner. Have an open mind. Make yourself comfortable. Ask your doctor about prescription. Get help from a medical device. Think about your new normal. Talk to someone. Build up your confidence. I've seen someone, she has put nice mehndi on head. So it is a way that okay, it's okay, I'm happy and I'm comfortable what I am today. I think that is the thing. Anybody who is not comfortable by yourself, I was very, very obese, but I was very comfortable. लोगों को problem होती थी मेरे मोटापे से, मुझे तो कभी कोई problem नहीं हुई. I was as confident as ever. So this body shaming people do, don't take that shaming. That is my always, that is my I can this thing say to the all cancer patient. Don't think because of cancer you have lost something. Don't lose your confidence. It's today you are living. I don't know, I'm going, somebody will hit me, I will have a RTA. So I'm living today, not for the tomorrow. So many time activities that make you feel happy and confident, the better you feel about yourself, the more you will able to relax and enjoy the sex. So breast cancer is diagnosed at the most productive time in the life. Concerned about childbearing, partner rejection, sexual function, body image, sexual attraction, these things are very common. So coming to just the GSM, we all know that GSM is a new terminology for all this vulval atrophy, vulvitis, urinary problem, sexual problem in the older age. Here it comes suddenly, so people are not ready to understand. We all know that we have to take the medical history, potential risk, and exogenous administer therapy. Yes, local introduction of the estrogen cream is the best thing, and mostly it is not going to affect the breast cancer survivor, but most of the oncologists is not ready to give, no patient is ready to take. So there's other option included for others, but not for these patients. Laser therapy has shown to the improve elasticity, vascularity, and the epithelial proliferation, and I have at least 10 patients of my who has shown the 70-80% regeneration of the laser therapy. So consider changing regular medication that affects sexual function. Pelvic physiotherapy, that's a wonderful thing. Always initiate. Then the sex therapies, sex counseling, they also play a big role. So treatment with the energy based devices is a new kid on the block for these patients. And carbon dioxide fractional laser, which I use, it has a wonderful effect, and it is absolutely in and out procedure, no anesthesia is required. And at the last, spirituality. Embrace it, make it a part of yourself, and start even teaching your young ones. When you teach your young ones, they become a teenager, they are ready to listen you. If you start with a young 24-25 years, they are not going to listen you, because they are hard in their thinking. Spirituality is one thing, body and life connect, that is very important. It is going to play as big role as a genomic treatments. So to conclude, breast cancer affects many aspects of the sexuality, including changes in the physical functioning and in the perception of the femininity. Sexual dysfunction following breast cancer should be diagnosed and managed as a systemic approach with multidisciplinary inputs. Healthcare professionals should assess the effects of the medical and surgical treatment on the sexuality of the breast cancer survivors. Sexual health, yes, has yet to be fully integrated into the oncology care, even for the cancer involving sex organs. The result of this examination of the patient experience discussing sexual function with the oncology providers underscore both the importance of this topic for patient and the survivors as well. Clinicians who are responsive to the patient's need in this area by delivering medical information or by acknowledging the patient concern may help alleviate the burden of the sexual side effect of the cancer treatments. Take home message is women intimate health is directly proportional, and you were born with wings. Why prefer to crawl? Thank you so much for your patient hearing.